It's a big event. But I don't think our discussion should be about death. Or even if we're going to die, how we're going to die. I think our discussion should be about how we're going to live and who gets to decide how we're going to live. That's where we should go. And to help inform that discussion, let's go back 20 years. 20 years to emergency department at Gunderson. In comes a lovely 82-year-old long-term dialysis patient. Daughter at her side, son at the other side. A devastating stroke. You're the nurse at the bedside. The daughter says, I know my mom, I take care of her every day. She would want to be comfortable. The son says, I haven't seen her a lot lately, but she's tough, she's a fighter, and I think we should do everything. Over and over, this got repeated. You're the nurse. She starts to gurgle, she turns gray. What are you going to do? What are you going to do? The implication is huge. Life or death for the patient, long term for the family. So many times we're in this situation where we said, only we knew what the patient wanted. Now the solution was in the mission, the core of the organization, to improve the health and well-being of patients and the community. So that's where we started. Let me tell you what didn't work. What didn't work was telling doctors to talk to the patients. What didn't work was having the patients fill out a form. Those are not bad, but totally inadequate. What we needed was, of course, the clinicians very involved, beginning, middle, and end. But we needed trained nurses or social workers, retired teachers, to have a consistent language, a consistent set of questions, a consistent place to store the information so that now a newly trained clinical staff could have that available. The organization, the healthcare organization, had to make it crystal clear that the wishes of the patients were paramount, and that not following the patient's wishes was a cause for peer review no different than a medical or a surgical error. The system had to have measurement. We had to measure our outcomes. We had to have both aggressive and less aggressive care, and we had to honor those choices. And so what happened? What were those outcomes? The outcomes were stunning. 95% of our seniors in the last 2 years of life have advanced care plans, most often shared with their family. 95%. 2 to 3 times what most of the rest of the country is. 98% of the time, those plans are available. And 98% of the time, the clinicians are able to follow those plans. Amazing results. And as a byproduct, by the way, if you allow patients to choose, they often choose less aggressive care. So Gunderson is at the first percentile for the last 2 decades in Medicare spending in the last 2 years of life. The first percentile at the bottom, not by design, but by the patient's choice. So you might say, well, Wisconsin, of course, they're all bachelor Norwegian farmers. People have told me this. And so, of course, it's easy. I said, you look at the Dartmouth Atlas. If you look at New York and LA, Philly and Miami, our seniors, our Medicare patients are older and poorer. They are fatter, they smoke more, and they drink more than those other geographic areas. It's really not that easy. Let's go back to our patient. What happens with our patient? Well, what happened then happens in many places in the country still today. There's a scramble of the families and the patients, caregivers. There's social service and maybe the chaplaincy. And they say, what do we best? Do we have aggressive care or less aggressive care? And we're still guessing what that patient really wanted. But in our organization, now many around the country, many around the world now, we have a system of care where through the eyes of the patient, they have the highest quality, lowest cost, most direction over their care they've ever had in their life. For the community, it's a fabric of the community. It's a way of life now in our communities. For the staff, it is remarkably less stressed in this time of life-defining moments. And for the organization had to rise up and say it was responsible to develop a system of care well beyond its normal walls. But it also had to demonstrate a relentless desire to let the patient decide how they wanted to live.